Thank you very much and welcome. And a logistics note just to start, the press conference will be held mostly in Spanish. For those of you who are here in attendance, there will be interpretation available. So if you need it, go ahead and pick up the receivers. Those of you who are online will also have simultaneous interpretation into English. And if there are some of the questions if some of the questions should be made in English, well, our panel members will be responding in English, but we will have the Spanish interpretation. So without any further ado, welcome to the second press conference, or the press conference of the second conference of the air pollution. Air pollution concerns us all, and it is in the center to generate convergence, generate conversations that allows us to tend to this crisis. This is an international event that gathers ministers of health, of environment, of energy, as well as um, civil servants. Among the participants of this conference, we also have professionals, health professionals, mayors, authorities, local planners, representatives from the critical sectors such as energy, transport, industry, the use of land, residues, as well as delegates from the investigation, the academic session, indigenous people, and local community. It is important for us to mark this conference some of the most critical data that call this conversation, which is the quality of air is the cause of the death of at least 7 million people worldwide, and approximately 71% of the deaths are directly linked to the use of fossil fuels. This is a high level event that will make it possible to discuss solutions to tend to this crisis, which is a global health crisis, and this by means of the implementation of actions, effective policies, interventions that prevent these premature deaths, improve public health, drive sustainable development, and connect with the crisis of climate change. This is a setting to drive dialogue and global actions that allow us to tend to this crisis that affects health and which is related to the death of millions of people in in the entire world, and that will allow us to focus our attention on human health and the right to the prevention of a disease. We will have Mauricio Cabrera Leal. He is the Deputy Minister of Policies and Environmental Standardization of the Ministry of the Environment and Social Development of Colombia, where strategies have been developed to establish synergies between air quality and the compliance with the global environmental commitments. Also with us, Dr. Maria Neira. She is Director of the Environment and Climate Change and Health Department of the World Health Organization, with 30 years of experience in public health and the environment, and has been key in the integration of public health and environmental sustainability. Also with us, Dr. Gina Tambini, representative of the World Health Organization and PAHO in Colombia, who has driven the technical cooperation, has as the fundamental access to tend to the challenges in health, and Javi López, Vice President of the European Parliament, who has worked on clean air, energy transition, and pollution reduction policies in Europe. So next, we will proceed. Our spokespeople will start with the remarks on the topics that calls us here to this conference. And we kindly remind our participants that following this first round of interventions, we will open a Q&A session for the list of journalists that we have already organized. And we kindly remind you that our participants will respond to questions that are specifically related with the global event that gathers us here today. So remember, spokespersons or spokespeople, you have about 3 minutes to make your remarks so that we can start with the Q&A sessions. Mauricio Cabrera, Deputy Minister of Policies and Environmental Standardization of the Ministry of the Environment, will open. Good morning, everyone. Thank you, Daniela. Thank you, my panel colleagues. This is such an important event of the country related to health an environment that the Colombian government has been working on, and for years, it is good to say that Colombia has been working for many years on improving the quality of air. A series of regulatory transformations have taken place this for years, thinking precisely on the problems on health and the environment that has been taken over the main cities of Colombia. In Cali, they had ever worse air measurements. They established themselves then uh, goals to be able to contain deaths, which were estimated at 7,000 deaths per year, and then work absenteeism that has generated losses of about 11 trillion pesos per year in economic losses uh, associated precisely to problems with air quality. But in fact, the government that made the government publish regulations which intent has been to include the work with the Minister of Energy in mind, the quality of the fuels, which had been progressively been improved with the Ministry of Transportation, also related with limitations placed on older vehicles and improvements on the quality of the vehicle fleets and the transition to hybrid vehicles, e-vehicles. We have developed regulations on those matters. Also, endeavoring to reduce the inequality we have with indigenous peoples and local and rural communities that are affected, among other things, because of the progressive increase of wildfires in the Amazon region are generating more impact. Colombia has developed an important strategy to tackle the reforestation in the country, and climate change has been generating ever more hot spots and fires in the country, and it affects cities at Bogota, where the fires have started and damaging the quality of air. The policy has been one of prevention, and this government has been working on a preventive policy in terms of public health. We have been improving the quality of fuels in the country markedly. There has been a reduction of the content of sulfur and an overall improvement both in diesel and petrol, which helps us reduce the effects to public health in the country. We're also involving changes in the uh, electrification of public transportation. It has been an important strategy that has been taking place in the main cities. Important investments have been made with the trains in Bogota and other regional trains, electric trains that will help us reduce the atmospheric contamination in the main city, the promotion of green hydrogen, the sustainable reindustrialization. The Colombian energy matrix is a clean matrix, is a matrix associated to hydro energy, but we are also doing the transition by strengthening unconventional sources of energy. And there is a bet from the national government to do a phase out of a fuel. We have reduced the share of new uh, fossil fuel projects, which has been an important strategy for a country that, such as Colombia, it is a producer. It is important. An improvement of the quality of life have taken place. Reduction of 40% of emissions of black carbon emissions by 2030 is an important norm that we know places us among the most progressive spots around the world in a problem that affects the urban settings. And a series of measures have taken place around the single-use plastic, which also generate atmospheric contamination, also generating public health problems, in addition to the important role that we have been having in the country with international conventions such as COOP, related to plastics. In fact, the country has made important investments, and the policy is determined to improve the quality of air in the country. Challenges are still big, but jointly with the other ministries and other entities in Colombia, also making our way to the smaller communities, small and mid-sized communities, and also hand in hand with the international organizations, the Pan American Health Organization, the World Health Organization, plus the international cooperation, which have been fundamental. We have been having very good results, and we hope to continue and reach the goal that we have set out for ourselves for 2030, and in the communications that we are preparing around the NDC. So we are completely willing to improve the quality of air in the country and the health of Colombians. Thank you very much. Thank you very much, Dr. Mauricio. It is interesting to see and start this round of remarks to see how the country that hosts us has incorporated or is working to incorporate steps that will allow it to improve the quality of air within the environmental policy and climate action, which are directed by the transition from fossil fuels, the other sources of atmospheric contamination, such as single-use plastic, and also actions being taken to change the energy matrix and reduce black carbon emissions. So Mauricio, thank you very much. I now hand the floor over to Dr. Neira, Director of the Environmental Climate Change and Health of the World Health Organization, to complement this with the global perspective that gathers us here today. Good morning, everyone, and those of you who are connected online. Of course, an appreciation to Colombia for hosting us in such a pleasant and efficient manner. We are happy to be here in Cartagena. Again, remember that these 3 days we are organizing the second global conference on air contamination and health, and there are very strong, powerful reasons why we have decided to gather this meeting, knowing what air pollution represents from the standpoint of public health. One, the contamination of air has turned into a risk, and the most important risk factor to health because of the diseases it generates. And air contamination has become the risk factor that kills the most, only after blood pressure. And I believe that with those arguments in the table, it's logical. It is a moral responsibility and a demand from the standpoint of public health. So to move all the institutions, all the governments, accelerate those interventions which are so necessary to end this risk factor, which is air pollution, which each year takes the lives of 7 million people. I believe that this piece of data, despite our repeating it often, it's as if it's 7 million lives that disappear every year, which and if they should not disappear altogether, at least a lot of disease will be held or bared by these people. Our hospitals are saturated with those diseases, so and they have to do with that exposure to the bad quality of air that we breathe, and that is why we have here in Cartagena 750 participants. Everyone that I say add to the effort of this action. The time to generate evidence has passed. We have a lot of it, and we used the first day of the conference on that. The World Health Organization, as you know, worked with first top-rated academic institutions with experts who have given us. I mean, we have over 60,000 documents, scientific articles published on how air pollution affects our health. And that first day of the conference was used so that we make sure that all the scientific evidence were to be known by all of us and shared, and that no one would then be able to say that they didn't know about air pollution. No, there are no excuses in terms of lack of knowledge, because uh, air pollution is one of the most important health risk factors. The second day, we used it to show that it can be done, that there are interventions, and you will hear a little bit on that, how we have been able to make progress. We have gone to China, which had one of the worst pollutions, to show that air pollution can be reduced. Just like you said, Mr. Deputy Minister, the other way around. There's an opportunity to grow economically, to protect the health of the people and reduce that mortality, but also at the same time to generate a healthier, more sustainable society, and relieve these hospitals, and lower the cost that those hospitals entail. And the day of the conference, the third day of the conference, will be important, not only because we will have important visitors, but also because it'll be the day of the commitments, where we will hear from various institutions, mayor's office, legislators, governments, scientists, civil society. We will hear what they undertake to. We want an objective, and we want it to be met. That is, reduce the mortality caused by air pollution by 2040. But that is, they're ongoing. Those countries that want to go beyond, of course, you're all invited to reduce that mortality before that 2040. Every time we add an initiative, remember that you're not only undertaking an environmental or energy action, no, you are taking care of the health, of public health. So again, I thank all of you who have come over here, those who have joining with us together in saying, enough, we want to breathe air that doesn't kill us. As simple as that, to be able to breathe an air that will not impair my health or kill me or cause disease. So thank you very much to Colombia, and thank you very much all the panel members and the participants. Thank you, Dr. Neira, for reminding us why we are here, for that, because of that critical public health crisis. And the goal, to remind us of the goal, okay, which is to reduce mortality due to air pollution by 50% by 2040, but also for reminding us that this goal does not mean that the countries might not engage in more ambitious goals or actions, which is what we are expecting for here. Now I hand the floor over to Dr. Gina Gambini, who is representative of the World Health Organization in PAHO in Colombia, who has driven technical cooperation as fundamental to address public health issues. Good morning, everyone. If you want to view, we are happy to be to have the media here in the room in this convention center in Cartagena, beautiful city. A very special greetings, Deputy Minister, dear Dr. Mariana, Director of Health, Javi López. Thank you, Rich. So, as a representative of the health, the World Health Organization and PAHO, for us, it is an honor and a pleasure. The reception that this conference has had, that data that you have heard and that I want to reinforce, require sectorial work by countries. We are listening. 7 million people are dying every year. 167,000 deaths in the Caribbean and Latin America. Um,
Ya viene.
we were, I'm sorry, but the sound is terrible. It's unintelligible now. The Pan American Health Organization. Disculpa, ¿tu nombre?
Yo le dije al muchacho, ya él me dijo que
Es
viniera.
urgente.
Sí, ya. Me dijo, ya, la chica. ¿Qué pasó?
Mira que lo estoy diciendo en que llegué. No se escucha bien, no se escucha bien. Thank you very much. Thank you very much, Dr. Gina, for reminding us that the agency is already enough to justify the action with respect to the contamination of air. It is one of the most important pieces of data. And then after having gone through a national perspective, which reminds us again globally a regional vision and the importance of scientific evidence, we will now hand the floor over to Dr. Javi López, who is Vice President of the European Parliament, to have, again, a broader regional view of the views and the policies that have been worked for clean air, energy transition, and reduction of the air pollution in Europe. Thank you very much. It is, in first place, I first wanted to thank Colombia for its move for a more leadership international in the first in the environment and the cooperation in the COP in Cali. Entonces, this work and this welcoming, and to thank also the World Health Organization and especially Neira for the work that they do to make bridges, to build bridges between policies, the policies that we design from the legislatures of all the world and the agency, that is the scientific knowledge and the evidence, scientific evidence that is so important today to to recognize this big work. Let me tell you about the experience of the European Union around the world in terms of pollution. The European Union has been working on air pollution and air quality ever since the late 80s. But during the last years, we have launched a new directive on air quality that we ended up approving in 2024. It is based in great measure on the latest scientific contributions that the World Health Organization has made, the latest guidelines on the acknowledgement and the production of science. Why? Because at the European Union, we consider that pollution, it is an invisible pandemic. It is a slow motion pandemic. It is one that causes 7 million direct and indirect deaths in the world, which in the case of Europe is 300,000. That is what the environmental agency says. In fact, the European agency has openly said that pollution is the biggest environmental threat to the health of Europeans, and that is why we have decided that is the Green European Pact, the set of laws that will allow us to decarbonize our economy, protect diversity, and combat pollution, to have a plan to combat pollution. The Zero Pollution Action Plan, that is the name of our plan, which objectives is to have no pollution by 2050 in the continent, and by 2030 to reduce deaths due to contamination by 30%. That is the goal that has been set. And for that, we have an instrument, which is a law, which is on the quality of law, which reduces cut by half the permissible standards, and for One Health, public health, as I have said, to protect the health of our citizens, because we are seeing a great threat under health. This fight against contamination will challenge our public budgets, which today use a lot of money to address all the diseases caused by pollution. Three, to also protect ecosystems which are affected due to pollution. And four, to combat inequality. Why? Because even though it might seem counterintuitive, not everyone, not all of us breathe the same air. Not every country breathes the same air, but within the countries themselves, not everyone breathes the same air. And within the cities, not everyone breathes the same air. Industrial sectors, low earning areas have a lower quality of air, which directly has an impact on the life expectancy. And you can see this in the great differences between neighborhoods. It is not only one, but it's one of the causes and that is shown in those inequalities that we see in cities or neighborhoods. That is why we have decided to come up with the air quality directive, which is part of the European Green Pact, which fights against climate change. Also part of our agenda to disconnect ourselves from the fossil fuels agendas. Thank you very much, Dr. Javi López, for reminding us a variable which is absolutely supplementary to everything that all of our spokes people have mentioned, which is the aspect of inequality. Not everyone breathes the same air, and this is one of the key points to take into account in this press conference. Now it is the turn of the journalists. So thank you. We thank you for your comprehension to remind the journalists that are online with us and wish to ask a question. Please raise your hand and include your name in your online profile so that we might include you on the list. And so again, I thank our spokespersons for their timeliness. And I will now hand the floor over to Pedro Mendoza from El Espectador to please open this round of questions. Thank you to you. two questions for Dr. Maria. You said the first day that there are no excuses, that we need to leave this place with advancements and commitments. You have said that today those commitments will be stricken today. Then question, have we made states and nations to go to actions after commitment? How to make nations commit? Second, I discovered that your name is very much linked to the event because your name is Maria Purificación. You say that it is a woman of risk. You have been at war. You once said that it was most important to have hair in the heart. What perception do you take the air of Colombia in socially and environmentally? Very much prepared. Thank you very much for discovering it. We wanted to hold the conference here in Colombia because we thought it was a country that had made progress in these policies. Sometimes when these decisions are taken, somehow, you value what that country is doing, but also by bringing the conference here is an indirect way of saying we want even more, but not even more from Colombia, but we want more from Mexico, from Argentina, and all the countries in this region. And my colleagues from the PAHO are in agreement. We are advancing strong, but we want much more advanced, what's happening in Asia, Southeast Asia. Yesterday, we saw very powerful reports from the most contaminated area in the world, most affected in terms of air pollution. So the social environment is breathed. Anything that is breathed, is good. Social, joyful, air quality, aesthetic. Hopefully that the environment and what is breathed is all positive, very healthy. Now, with respect to how to make states to commit to goals this afternoon or today, how to make sure, well, that the World Health Organization, we have no capabilities, legislative enforcement, but we are pushing through the European Parliament. We have very good example on how they approved a directive, and that directive does have legal consequences. So the role of the World Health Organization is that with those guidelines, with those standards that we have designed, some say they're very ambitious. I think that ambition is never enough, but we need to inspire governments to move to progress on legal matters, legislation. Invite them to set up a monitoring system, but then we also have a way of estimating the deaths associated to those policies that were not implemented, or the opposite, which we like more. It's to quantify the lives that have been saved thanks to those policies that have been implemented. And I think that positive influence, stimulus is working with mayors. Sometimes it is not as popular with us as we need to disseminate that information among the population, how many lives have been saved. Though the politicians value that, as Javi López said, there's an economic benefit, there's an equity benefit, there's a social in the protection of ecosystems, but mostly there is the health benefit, which in the case of citizens is also good to advance. Thank you very much, Dr. Neira. We now ask Ricardo Maldonado from the EFE news outlet. Thank you, Dr. Neira. Ever since 2015 to date, how do you, from the organization, gather that the quality of air has improved or not, and what sectors of the world? We would like a global view on this, and also focused on Latin America. Well, thank you, Gina. If you wanna say something about Latin America, but evidently there had been lots of progress since 2015. Most likely, the progress is focused on Europe and North America, but there have been progress made in general, except like in Southeast Asia, where the, the problem has been stabilized or increased with respect to 2015, but the awareness is higher today. There are big advancements and progress and interventions which show how those interventions work when implemented. And in Latin America, there is an improvement also. Evidently, as I said before, um, ambition is never enough because, but we have advanced a lot in monitoring. Now there is much awareness on how to monitor the quality of air and also knowledge by the citizens on how that quality should be. Now, with respect to all the interventions that I heard from the Vice Minister, but lots of progress made worldwide, such as that which I mentioned about China. China used to be one of the most polluted countries in the world, and they are now showing scientifically proven way that they are reducing the levels of pollution. So it can be done. As, India continues to face challenges, difficulties to control, and still the most populated states uh, continue among to be ranked among the most polluted cities. But we see a lot of progress since 2015. So we hope that from now on, the growth in terms of advancement will be exponential. Of course, from the standpoint of public health, from the World Health Organization, we are not going to curtail any effort. Au contraire, we will be ever more on top of this problem because our life depends on it. Uh, well, they have improved globally. There are still some hotspots where that progress has not been as good, but that is because we have problems with monitoring air quality in Africa. We have to use estimates because the monitoring is not too effective. But so, like I said, overall, it has improved with some problem zones yet in existence. Of course, Daniela, thank you. Yeah, in relation to the region of the Americas, that the countries they have approved the action plan for the Americas on health and air quality, which follows the roadmap as created by the organization that there is a commitment, and the secretaries, the functionaries contributed, as I said, in terms of the action line. Also, a very important initiative from our director. It is to work for the elimination of the use of wood to cook is one of the conditions that is this plan for the reduction of disease and conditions. The use of wood and biomass to cook in the country, well, have undertaken extensive efforts to reduce the use of that. Thank you very much, Dr. Neira. Yo quería Perfect, Elsie. My question goes to Dr. Gina and the Deputy Minister in Colombia, how we are faring. How are cities such as Bogota, Cali, which is always seeing complications with even Cartagena, where this event is being held. I mean, specifically, what are you doing at the ministry to counteract, you know, effects to air and whether, in fact, the citizens who have to have a sense of belonging or ownership are doing this? Are you seeing a solution? Well, in Colombia, first, we need to say that Colombia increased the number of monitoring stations markedly precisely to verify whether or not we were complying, and the results have been very important. Right now, we went from PM 2.5, that is surely the community has identified the matter of the size of particles, that especially those particles that are below 2.5 micra are the ones that generate the most problems to health. Also, those are 10 micras, but we were able to identify that the baseline was dated 2018, and the stations that comply back then in Colombia was 35.3% of the stations were those that met the standards as compliant. Today, 59 of the stations are those that are compliant. And for PM 2.5, the ratio went from 30% of stations that met the goal to 41.5%. There has been a marked improvement, and I think that those of us who live in the main urban cities in the country, we have seen. I remember Colombia. Colombia has a big challenge, Bogota in particular, because of its elevation. The combustion of diesel was a limits to imports have been set. Vehicles will progressively leave. Some are active now, incentives that are for the import of vehicles for that energy transition that is also yielding results. And the parts per million, actually, the results in are showing that the air quality is better, but there are challenges still that I mentioned that are associated with climate change, with deforestation, which we see far away, but it so happens that Bogota at time there had been an affection of operation because of the quality of air that we are experiencing because of burns that are happening at 500 kilometers from Bogota. So we need to have an articulated view, and we at the Ministry of Agriculture and Environment have endeavored to have such a view. All that we do is part of steps that are geared towards, among others, improve the quality of life and the environmental conditions in cities. The results are good. We have to improve them. I mean, the challenges are there, but decided action by the government has helped to improve those situations. Thank you. Thank you for the question. As the deputy minister said, that the city indexes are improving. There are emerging problems such as fires, but this response by cities lie in the improvement of public transportation, the planting of trees, the articulation with the citizens and the academies, the country with one of the first countries to derive health um, effects. Colombia is international leader with Colombia is positioning itself as one of the leaders in Latin America with that response to air pollution. We will take an online question, and the last question from the people here, because we now have to go to the plenary session. So I will read one of the questions that we have online. Respiratory medicine from DJ Shankar.
Hello, thank you very much for taking my question. I'm Vijay Shankar Balakrishnan, representing the Lancet Respiratory Medicine. Can you hear us? Can you hear me? Okay, so my question is, how does the current geopolitical climate influence or move the individual country targets on air pollution? Which geopolitical affairs would severely affect what kind of targets in countries? This is a qualitative question to everyone on the floor. Thank you.
Thank you so much. We will now hand the floor over to the last person so that our panel member might go to the plenary sessions. Daniela Roscoe, Blue Radio. Good morning. My question is related to the monitoring systems. Someone said just now that there are difficulties in Africa to conduct these measurements. How is that going? Where are they established in the monitoring systems, and where are the difficulties? Because in Colombia, the director of the Environmental and Climate Agency told us that we're not improving our capacities to measure the quality of air. EVM is like the agency that supervises the environment and the climate. It is one of the challenges that we have in terms of monitoring of the air quality, and that from the World Health Organization, every partner, every actor with whom we work, we're improving ever more. We need to generate a harmonization on the collection of data that are modeled, that will allow us and allows us to estimate, but like in Africa, we still need a lot of ways to go in terms of sources for monitoring. If I think that with various initiatives in the next 2 years, there will be a substantial improvement on that. Would you like to say something, Javi? Well, I believe that maybe two things are interesting. One, monitoring for the new directive of the air quality of the European to the European central matter, reinforced monitoring mechanisms specifically to have monitoring that will be ensured to be representative, because monitoring certainly is not 100% representative of reality, and this is something very important. But now that I have the floor. Thank you very much for leaving us with this geopolitical context and global multilateralism, which we need to work, most of all because of the health. Now, I'd like to remind you that Daniela Duran, senior consultant for the International Environmental Center, air is a human right vital to health for the well-being of everyone, especially for those most vulnerable. This human health crisis where we need to tend to the number of deaths that are being caused, but also to have economic benefits and benefits in terms of human health. Well, that is why we are here to reach ambitious goals that will exceed those that we set out for ourselves today. We thank you very much for your attention. And the participants, we invite you now to move on to the plenary and have happy rest of the day.